Okay, so we're going to go ahead and get started. Thank you all for being here. If I get our panelists to turn on your cameras, we'll go ahead and kick off here. My name is Taylor Lowry, and I am one of the counselors in career services here. I want to thank you for being here and welcome to Careers in Women's Health. This is the first time we are offering this program, and so we're super excited to offer it in celebration of Women's History Month this March. When I was thinking about planning this program and what I wanted to be about, I knew I wanted to do something around healthcare because I work with our health sciences students. So I knew I wanted to focus primarily on that as a sector. Now, if you're like me, when you think about healthcare, you think about going to the doctor and reaching out to nurses and asking any medical questions you may have. And it is that, right? But it's also mental, spiritual, it could be financial, it could be cultural. It is all of the things. Women's health is multifaceted. So that is really how this panel was born. We have some great professionals here who are going to speak to just a few of those areas by way of their own careers and experiences. So in a second, we're going to kick off with some introductions to our attendees. Thank you for being here. Know that you are welcome to ask questions at any point throughout the program, and we will just put a pause on our questions and make sure we are able to get those answered for you. So without further ado, I'm going to go ahead and call on Allie to kick us off. If you will just start off with your introduction, and then we're going to move on to Brandy and Ivory. But introduce yourself, including schools you've attended, work experiences, your degrees, and then leading up to what you're doing now, including your roles and responsibilities.
Perfect. Hello, everybody. My name's Allie Pashi. I'm a graduate of Otterbein University, where I earned both my Bachelor's of Science in Nursing and my Master's in Healthcare Administration. Currently, I work at Brightside Health as the Care Navigation and Care Coordination Manager. Brightside is a telehealth mental health company that delivers depression and anxiety care through both therapy and psychiatry. In my current role, I manage all things access to care for our patients and prospective patients, as well as work with private practice providers, hospital systems, OBGYNs, and other online platforms for patient referrals within their respective specialties. Prior to Brightside, I served as care coordination manager at Planned Parenthood Gulf Coast, leading care coordination in women's health for all of the Planned Parenthood locations in Southwest Texas, as well as Louisiana. I also served as the Assistant Director and Operations Manager of the Student Health and Wellness Center at Otis College of Art and Design in Los Angeles, California.
Thank you. You had that down to a science. You're ready.
I do what I can, Taylor.
Taylor,
Appreciate it.
before you continue on, you are not streaming on Facebook.
Okay, great. Good to know. Give me a second.
Okay.
Let's see here. How are we doing now?
Let me double check. I don't see it yet. No, it's still not there. And it says when this happens, it's usually because the owner only shared it with a small group of people or changed who can see it, or it's been deleted.
Okay. We're just gonna roll with it. Let's try it again.
Okay, no problem. I'll keep testing it.
Okay, you know what? I am not going to worry about it because we have great panelists here and I don't want to take up any more time. But we are recording the event, and so we will be sharing this out to anyone who may want to view. Is that okay?
That sounds good.
Okay. Brandy, if you'll go ahead with your introduction.
So I was trying to fix my lighting. Hi, I'm Brandy Rahim. I'm a licensed mental health therapist. I got my bachelor's degree from the Wright State University. I got my master's degree from Northern Kentucky University. Both of my degrees are in social work. I started my career working with families and children. I worked at Children's Services. I worked for foster care agencies, mental health agencies, and then I moved to working with adults living with HIV and AIDS. I did that for about 3 years, and when I got my master's, I went on to work with mothers who were pregnant or postpartum. Did a lot of mental health work around like perinatal, postnatal care, worked for the hospital. And then I left there and did private practice. And so now I'm doing private practice for mothers, children, mostly Black women, but a lot of moms and babies and children's and things. I've also done some school-based, so I do that part-time. I go to schools twice a week and work with adolescents. So mental health is my thing. Mothers and babies are my little special niche that I have. So glad to be here. Thank you for having me.
Thank you. Ivory.
All right. So yeah, my trajectory has been pretty interesting. I will see how I can say this concisely. So currently I work at Zora's House, which is a co-working and community building space for women of color. I am the programs and partnerships manager there. And I'm also a certified yoga and meditation guide, which has led me to found the nonprofit organization Black Women in Nature, which I think was one of the reasons why Taylor originally reached out to me. So to give a little bit of background, I got my bachelor's degree in communication studies from Texas State University. Then I came to Ohio and received my master's in higher education and student affairs. And so for close to 8 years or so, I was working in higher education with college student development, program development, and those different things. So I did quite a bit of work around diversity, equity, and inclusion, just kind of that transition from high school to college with some first year students. And then my last role at OSU was in the Wellness Center, kind of focusing on holistic wellness and really reflecting on kind of those 9 dimensions of wellness, emotional, social, spiritual, environmental. And that around that time is when I also started teaching yoga and meditation and started Black Women in Nature. And so, yeah, now once again, I'm working at Zora's House. And so it's kind of a collective and the work that we do. It is geared towards women of color really being able to focus on thriving, not just surviving, because that has been a lot of our narrative. And so the programs that we develop, while they are not always necessarily health and wellness related, that is a core part of the work that we do is really focusing on how do we support women of color thriving and everything that they do. And so there's always some kind of wellness component a part of the work that we do. So yeah, there's a couple of different areas that I'm a part of when it comes to wellness. So yeah.
Great, thank you all for the introductions. And I think I saw our 4th panelist pop on. Vivian, are you there? We'll give a second. Might be some technology issues. So Vivian, whenever you're ready, we will come back and get to your introduction. For now, we're going to go on and move into our questions here. So the first one is just for each of you, of course, you're coming from different areas. You just gave us those great introductions. How would you define women's health? And then how that works within your field and what does it mean to you? So we're going to start off with Allie.
Yeah. In my current field, like I'm working in mental health, and women's health manifests itself in so many different ways. Specifically at Brightside, where I am, most of our patients that I'm able to connect to care or coordinate a higher level of care with have dealt with or are currently seeking additional support in managing their anxiety and or depression, with just so many other factors, like history of self-harm, assault, trauma, pregnancy or miscarriage, postpartum depression. There's just so many obstacles and experiences that people of any gender may face, but those that identify as women face other obstacles that just add an additional layer on to that level of support that's needed. So that's kind of how I would describe it and define it within my current field. For me, it really is just a focus on the woman as a whole person, being able to attack that anxiety and depression head on, regardless of what the underlying factors are, is just really important. And that's something I'm very passionate about. So just being able to kind of marry all those things together within my specific day-to-day in my role.
Thank you. Brandy?
Yeah, so I guess I would piggyback off of that and just say that I feel like when I think of women's health, that I'm thinking of a lot of my services are holistic. So I'm thinking about her mind, I'm thinking about her body, I'm thinking about her spiritual health, and how all those things connect. Because I'm in private practice, I have a lot more freedom, which is what I loved about like stepping away from the hospital, because the hospital focused a lot on the medical piece, and then they did integrate the mental piece. But I feel like we were leaving out, our spiritual selves, our faith and our wellness practices outside of like the hospital or the therapist's office. So I feel like health just encompasses the whole person, her environment, where she grew up from, her childhood, um, her behavior patterns, how she's eating, is she sleeping? And so just everything that makes up the whole woman and how she's able to show up every day as her best self, and in the best of mood, and eating the best of foods, or being able to parent her children the way that she wants to, being able to be the type of partner she wants to be. So whatever's gonna aid her in her like happiness and wellness is what I look at as health. If it's affecting her in any way, then I feel like it's affecting her health, essentially. So
Absolutely. Hey, Vivian, how are you?
Hi, can you hear me?
Yes, we can hear you.
Okay, I'm sorry, I'm bad at computers at Baseline and I got a call right before I was supposed to come in the room. So I apologize for bursting in here.
Oh, no, you are totally fine. We're just on the second question. So Ivory, I'm gonna have you pick up with that and how you define women's health. And then Vivian, we'll come back around to your introduction, have you answer the question as
Thank
well.
you.
Awesome. Yeah, my response would be very similar to what was shared, especially from Brandy. So really that holistic perspective, and really it being kind of, what the individual person identifies and feels like she is feeling well and feeling whole. And so coming back to for me, even more specifically, kind of with the yoga and meditation and Black women in nature, that a lot of that physical wellness, but within that we work a lot intentionally with reflective dialogue and having some intentional conversations to help folks really connect kind of some of the emotions that they're experiencing and how that is showing up in the body. Oftentimes we don't always have that mind-body connection. And so it really is kind of allowing space for those two spaces to talk to one another and see like, okay, how do I feel about myself? Am I getting the rest that I need? Do I feel supported? All of those pieces that impact kind of that emotional, physical, social wellness. Do I feel connected to myself? Do I feel connected to a sense of community and others around me? I think all of that affects health and a sense of wellness.
Great, thank you. I'm hearing a lot about intentionality and how one piece of our health affects another piece, which we all know this, but I don't think we ever really take the time to think about it and what it means, and then what it means for us specifically, not the person sitting next to us, but what it means for us to, take care of all those different pieces of ourselves. Vivian, if you would just jump in with your introduction and background, and we'd love to hear your perspective on the question as well.
Sure. And again, I apologize for bursting in with my technology issues. So my name is Vivian. I'm a nurse practitioner at Ohio Health, and I work in gynecologic oncology. So women's cancer, cervical, ovarian, uterine, vaginal, vulvar. So all we take care of is women here. So I have been here, it'll be 8 years in July. So I've been here for a while doing this. I'm kind of probably an odd bird. I went back to nursing school at age 31. So after college, in my 20s, I kind of did a few different things. I did some development and fundraising. I did some legal stuff and ended up back in nursing school at 31 because I finally knew what I wanted to do when I grew up. So I encourage people to take your time, and if you need some time, it's not the end of the world, because now I feel like I'm in the right spot finally. But here at our practice, like I said, we take care of women's cancer. So I do things like see people after surgery who have post-op problems, clear people for chemotherapy, see surveillance visits. So kind of the spectrum of people during their care for a woman's cancer. So my background is I have a Bachelor in Arts many years ago in psychology. And I went back to nursing school here at Ohio State. I did a program called the Graduate Entry Program, which was 3 years full-time. You kind of go through, do all your RN schoolwork, test for your RN, and then start your master's program, and then kind of go through all that in 3 years, and then out in the world. And then I did a year-long oncology fellowship at Ohio State. So we did like all different kinds of oncology. I did breast cancer care for quite a while during my fellowship in that year. Then I moved on to gynecologic oncology towards the end and never left. So that's kind of my background.
Okay, great. And I feel like you probably already answered this question in talking about what it is that you're currently doing. But anything else you want to add about how you define women's health and what that means within your field?
So I think we can get kind of lost in the weeds in our practice that we're just kind of taking care of, the disease state in front of us. But I think, as people respond well to treatment and are living longer lives, something that is really important to me is kind of quality of life and health promotion. How you can, yes, you have a cancer and we've treated it and you're doing well, but we can do things to extend your disease-free interval or prevent the cancer from coming back, or just, living life better. And this is can be sometimes kind of a wake-up call for people. So for me, that's an important part of my care. How can we make things better from here on out? How can you enjoy things? You have to enjoy your life. My patients, even during chemotherapy, they're afraid to, delay chemo 3 days because they have a family reunion. I very much encourage them to do those things because, you never know. We're all kind of in, walking this world, and we need to enjoy our family, friends, and, we can't forget that in the scheme of all of this. So that's always a big thing. My patients always know that I will reschedule anything for them if they want to go and enjoy something, because that is why we're doing all of this. So that's probably my biggest thing. I'm trying to think if I wrote anything else down here. Yeah, that's probably good for me for now. I don't want to monopolize too much time.
Okay, thank you.
You're welcome.
So we're going to, I'm going to call on you again, so it's okay. You just keep talking.
Okay.
So this one's going to be directed to Vivian and Brandy. What kind of training and background do you need for what it is you're currently doing? And I'll call on Vivian first.
Okay. Yeah, so I kind of said my schooling. So in addition to schooling, so RN licensure, and then after you finish a master's program, then you have to go and certify, and there's different areas for nurse practitioners. Adult health, there's geriatric health, there is women's health, psychiatric health, family nurse practitioner, acute care. So there's all these different tracks, and you kind of train in your master's for one of those, and you take a national certification test. So that's another kind of testing we have to do. You also need your state licenses, RN and advanced practice. So there's a lot of things to kind of juggle. I definitely have a spreadsheet that I know when things are coming due, and you have to keep it up, because once you let one of those things lapse, you're practicing outside of your scope and the law. So you have to be very careful about those things. but yeah, so once you kind of get all your things, you know, all your tests done and you've passed all those things, it's just a lot of renewals, keeping up on continuing education. And then here at our particular practice, I'm working towards an advanced oncology NP certification as well. So a little slow going right now, but I am working towards that. So that'll be just another facet that I can add to my women's health piece. Even though that's what I do all day, kind of learn new things and kind of get a different perspective studying for that.
So I hope all of our students on the call who are going down the nurse practitioner track,
Yes.
like, it's a lot. So
Yeah.
please reach out, find your community, find your network, and figure out who you need to ask to make sure you can stay on top of it, because that sounds like
Yeah,
you've
like
been
I
doing
said,
a lot.
keep a spreadsheet, and they will warn you when your things are coming due. But
Right.
it's just, you have to stay on top of it. And once you get into the flow of it and you're continuing ed and all that, it's okay. It will all make sense after a while.
Yeah. Brandy.
Yeah, sounds a lot like the social work board. So
Mhm.
I got my bachelor's, so I did my first 4 years with my bachelor's degree, and then I wanted to do more clinical work. So then you have to get a license. So you have to take an exam. So I took the BSW exam, and then once I got my master's, then I went and took the clinical exam, which allows you, again, just to do more things, more clinical work, do assessments, bill insurance, things of that sort. So I literally just passed my clinical exam in February. So I'm newly independently licensed. So once you're independently licensed, you can run your own practice, do your own billing. Again, it just opens up a lot more freedom. You can supervise. So I'm working on my supervision designation so that I can give supervision hours to other clinicians the same way I had to get hours. So for each licensure, you have to get a certain amount of like face-to-face clinical hours. You have to go to supervision where you sit with other therapists and you guys staff cases, get consultations on what should I do with this client, or it's the issue I'm having. And so you're constantly learning in this field. They want you to always have continuing education. So to renew your license every other year in Ohio, I think it's every year in North Carolina. I'm licensed in 2 states, but you have to have 30 hours for Ohio and then 40 in North Carolina. So they always want you to be doing continuing education. I just finished the EMDR training, so I'm working on being EMDR certified. It's a new treatment modality for people with complex trauma and PTSD. And so again, working with Black people, we have a lot of generational trauma, complex trauma, PTSD. And so I'm really working with a lot of my clients on how to desensitize themselves to that, along with, you know, Reiki, yoga, just I'm into a lot of different treatment modalities. So I'm always just trying to learn. So yeah, it's a lot. It can be a lot to keep up with renewing and getting your continuing education. I think last year I forgot and I needed to renew in January. So from January 1st to the 24th, I did a CEU every day to get my 30 hours. Do not do that. Do not do that. Because that was scary. Like, oh my God, am I going to make the deadline? And I did. But don't do that. Do not recommend.
Don't do that.
So yeah, somebody asked,
Yep.
can you explain more about the scope of practice for a bachelor's degree?
So yeah, let me go ahead and read it out loud for those who aren't, who have called in or can't see it. So
Okay.
to Brandy specifically, can you explain more about the scope of practice for a bachelor's degree level social worker and master's degree level social worker, specifically the types of jobs you can get with a bachelor degree?
Okay, so with your bachelor's degree, you're doing more case management. So this is doing more like connecting to resources, referrals. This is a lot of like coping skills. So maybe you are working in mental health. And so, for instance, when I worked with kids, we worked on a lot of like anxiety, breathing, play therapy, things like that. And again, you can't like call it therapy and you can't do clinical assessments and things like that at the bachelor's level, but you're doing baseline services. Again, lots of referrals or just progress notes of this is how the client is progressing or this is how they're not. Referring to higher levels of care. So if they need therapy, you will refer them to that. If they need med management, you will refer them to that. So it's a lot of overseeing that I did. But at Children's Services, like I was an investigator. So I went out and did home visits, and I investigated allegations of abuse and neglect. So that there's a lot that you can do at the bachelor's level. I think once you get to the master's level, you're doing more clinical work. Like you're doing therapy, like somebody coming to sit on your couch, seeing you in our office. You can do an actual assessment. So you're essentially diagnosing someone. And so you get more into the why. I think that at the bachelor's level, it's more the what, like what's going on here, and okay. And then when you're at the therapist, you're like, okay, now somebody's being referred to me that came from case management. Now I'm getting to the why. Why are these their patterns? Why are they not progressing? So again, I'm not going to say you do the same thing, because obviously you don't, but the master's level is you're getting more clinical, more deeper. You're working probably in the hospital. You're working next to the nurses. Bachelor's level is more like case management, more agency work. But yeah, they're both great. I think bachelor's sets you up to be a good clinician. So.
Great, thank you. So we are going to transition to talking more about other skills that you all have that prepared you for your line of work. So specifically to Ivory and Allie, outside of your academic degrees, can you talk about what skills you have that prepared you to go into your line of work and where you gained them? So that could be organizations you've been a part of, leadership roles, volunteer work, anything that you did that you felt prepared you for your current role. So we'll go Ivory first and then Allie.
Yeah, so quite a few things, especially kind of on the yoga and meditation. So I received my 200-hour, which is kind of like your basics for becoming a certified yoga instructor, in 2019 through Yoga on High Teacher Training Institute here in Columbus. I believe the name has since changed. So yeah, I received that, and I've also received training on yoga from a trauma-informed lens. So just diving a little bit deeper into some of the things that I was talking about a little bit before about, especially when it comes to communities of color, how do we get past this space of not only just surviving but thriving, and recognizing kind of a lot of the pain and the stress that we hold in our bodies from everyday encounters, the stressors within our nervous systems that impact our feelings of wanting to fight or flight or freeze, right? And so I'm also currently in an advanced 300-hour teacher training where we're diving a little bit deeper into polyvagal theory, which is talking more about kind of your nervous systems and how that impacts how you show up in spaces. Oh my goodness, a deeper dive into breath work. Yeah, a lot of us are not really breathing well, and that impacts our daily lives. And so, going over a lot of different breath practices, what else? And different forms of meditation. So that is probably the most extensive amount of additional training and skill building that I've been doing outside of my academic work, but definitely have been very heavily involved in community development, community work, nonprofit work. So yeah.
Thank you.
Awesome. I guess for me, within my current role, just like additional involvement that I have, I lead our Black Employee Network, which is our ERG, our Employee Resource Group. Being involved in this space, it really is separated from like the day-to-day work, but it just helps to just build relationships cross-functionally within the organization and just like improve communication skills, and just provide that extra level of comfort for when I need something from the marketing department or from another place that I typically don't work with. I've just already like lowered those barriers a bit just through that involvement in that role. As a student on campus, I was extremely involved in all of the things. I was an orientation leader, resident assistant, residence life coordinator, peer mentor. If it was in student services, I probably did it. But in hindsight, all of those spaces just helped challenge me with public speaking, teaching, and learning in large groups and small groups, working collaboratively with someone who just like might be very different from me, and just exposed me to a lot of different people with different backgrounds and experiences, and just opened my eyes and my heart to learn more about others. And I just feel like all of those experiences together really just prepared me for this role. And dealing with people day to day who are struggling with different aspects of their mental health, and just being able to approach them sensitively, and being able to approach them just with an open mind and open heart. And so I definitely just think that all of those things combined have helped me at this point in my career.
What I just heard both of you say is that learning never stops.
And never.
And it is important to get involved. So, and we tell students that, we preach this, and sometimes I think they don't believe us, but now we've had someone else, a third party, say, get involved. It is going to help you now and down the line. So thank you. So shifting gears a little bit, this one's to Vivian first, and then Brandy. Would you just describe your average day?
Sure, my days are, it depends, they're varied. Some days I'm just seeing people in the office, they have appointments. I'm seeing, those different types of patients I mentioned, patients that are having issues, patients before chemo, patients just coming for a 6-month follow-up, those kind of things. Some days I have more of an office-based job, but I'm looking at CT scan results, labs, I'm working on my chemotherapy plans. We kind of overlap some of those things with pharmacy. So if you're like those kind of things like I do, it's kind of fun to do that little piece as well. The nurses are triaging for us, so sending us questions all day with things they're not sure what to do. Working with my collaborating physician. Here we all, in Ohio, you have to have a collaborative environment with a physician. All nurse practitioners need this, and to have an official agreement. We cannot practice independently in Ohio. Other states are differently. So I work very closely with my physician. We will talk about patients, make plans. I'll help her with any issues she's having and things like that. So it kind of depends what is going on that day and what's happening. Some days patients will come in and they're acute, and we have to work on admitting them to the hospital and working on a plan for inpatient management. So a lot of different things. I think being a nurse practitioner, you kind of have to be ready for whatever is going to come your way, because you're kind of expected to help. I know here in our office, every level, front desk might ask us questions, nurses, surgery schedulers, we're kind of the ones here, as our surgeons are over in the OR most times, and we are here kind of in their place, and we're kind of the next level down to kind of help everyone. So very varied. Not really sure some days what, you come in thinking the day will be like one thing and it turns into something totally different. So definitely keeps you on your toes.
And then same to you, Brandy.
Yeah, so my days, I don't know, it depends on the day. Some days I have clients back to back. I try not to make them back to back just because that's a lot on me. But so some days I'm seeing clients back to back, and that is either at home on Zoom, or the ones that are at the school, I go to the school and see them at the school. Other times I may be in a meeting. Maybe there's an IEP meeting, maybe there's an issue at the school and the parent needs to be involved. And so just me being the therapist, I like to attend just so we can collaborate. I also do a little bit of doula work. So it could be a consult or just maybe a 30-minute phone call on a mom who has a lot of questions. I did a lot of work in maternal and child health, so I still do some of that work. It could be a day where I don't see clients at all. And so maybe I'm catching up on my notes, because documentation is very important and you will not get paid if you don't do your documentation. So I try to set time aside where I can stay on top of my documentation for billing purposes, but also so I can keep track of the client's progress and what they're going through. You can get subpoenaed, sometimes doctors ask for records. So again, just setting aside that time to make sure I'm doing proper documentation. Some days I'm out in nature, reconnecting with myself, because it is heavy doing therapy and taking on a lot of people's stuff. So I may go to a coffee shop, if it's a nice day, I may go to a park. So it really just depends. And I'm glad that I do have the flexibility to, plan my days out to work the way that I need them to. So, yeah.
Thank you. And you said something important, that documentation is important. And I feel like that is with anything that you do. So if you don't have any other life skills, please document and please pay attention. Attention to detail is very important across careers. So I'm coming back at you, Vivian. Is there a demand for people in your occupation? We might have some nursing students on the line who are following a similar path. They can talk about, so can you talk about the demand in your field?
Sure. I think when I started in this field, NPs were very demanding because there wasn't that many of us. Since then, I think a lot of people have gone to, nurse practitioner track schooling and kind of moving away from the bedside, because the bedside, especially with the pandemic, has become, I think, more difficult. Just staffing and everything like that. Nurses are asked to do a lot more than they used to do. So I think there's still definitely a demand. You always see postings. I always hear of offices looking for people. There's so many different fields and kind of tracks as a nurse practitioner. And if you want to do women's health, you don't have to, go and do the women's health track. You might be able to do family medicine and then see women in that kind of primary care setting, or the psychiatric track. That's something in this country that we need so many more practitioners. And that's probably, I would say, the most demand track right now that they're hiring the most for, to be honest with you. But I think if you have a passion for any particular area and, work hard and try to make connections and, kind of seek out every opportunity, I still think that there is demand for this area. One thing I will say, I did the graduate entry, so I had very little RN at the bedside experience when I started as a nurse practitioner. I think now I've kind of, I've caught up and learned a lot of things, but at the beginning of my NP career, I think more of that would have been helpful to me, and I think just beneficial to my practice. So I always, now when I talk to nurse practitioner students, try to get a few years experience, really know what kind of track you want to go to and what population really interests you, and, that you want to spend all your time working with. So that is one thing I always tell students now, but I still think there is definitely a demand.
Right, thank you. I think that'll be helpful for some of the students we have who are going down that path. So this one is going to go to Brandy, Allie, and Ivory. Brandy, I know you've been talking a lot, so let's go to Ivory first and then Allie, and then we'll come back to you. But are there entry-level jobs that students could research that may prepare them for a career in a job similar to what you're doing?
Yeah, so as I mentioned, kind of with Zora's House, there is more of that. It's not necessarily a direct like women's health and wellness job, but a lot of the work that we do, because we focus on our target population is women of color, right? That is a part of everything that we do. And so for me specifically with program management and development, there are a lot of entry-level positions that are program coordinator roles to get folks started on creating programs, events, initiatives, right, to help communities, whether that is in more of a nonprofit sector or in the higher education space, right? There's a lot of opportunities for program coordinators to offer support around creating unique experiences for people to come together in spaces that feel safe, that in spaces that provide a sense of belonging, so that they can authentically explore their feelings of safety and well-being or lack thereof, and community that has a similar background as them. So definitely a lot of opportunity there. And I also speak from the yoga space, right? There is for sure a lot of opportunity there as well. I think, with the pandemic, a lot of desire and need for wellness and a physical movement and meditation really heightened during the pandemic. And as we all are still kind of finding that balance between working from home and the kind of these hybrid spaces, you know, the question is consistently like, how do I, you know, now that I have this ability to work from home more, I do have more time to maybe go to a yoga class in the middle of the day, or, you know, turn on a YouTube video or something of that nature, right? People, I think, are being a lot more intentional about trying to prioritize space to do those things, to take those moments to pause and to be still. And so there's lots of course, yoga studios popping up, but there's even lots of opportunity. I know I've had opportunities to offer yoga workshops and retreats for employee groups, and coordinate different series. I'll be starting a prenatal yoga series here soon. And so, yeah, there's a lot of opportunity, I think, around kind of the physical movement space as well.
Great, thank you. All right, we're gonna go to Brandy next. If you would talk about, you gotta stay on your toes with me.
Okay. I'm trying to think of entry level work, but well, I don't know. Because a lot of the social work jobs, you have to have a social work degree.
Mhm.
I will say that it's good to get into the population you may want to work with because that'll be your experience. So for instance, I did the family and children track, but I had always been working with kids my whole life. So I worked at daycares, I worked at a school, I did work study at a school, like an elementary school. And so when I went to apply to be in the social work profession, you know, I had already had that experience. And you also do internships. So you'll get your experience even before you get your degree. And so again, interning in places where you could see yourself working. I interned at Children's Services because I knew that I was doing the family and children's track. So that kind of set me up for that. But get into your population. If you want to work in geriatrics, if you want to work at nursing homes, go work at a nursing home doing, you can start in dietary. You know what I mean? You can start being, you can do the food, you can do whatever, front desk, just get into the field or the area of population that you want to work in, because that'll be your experience. That's literally how I knew I wanted to work with children, because I was working at the school, but I was drawn to the kids with the behavior issues. And I'm like, why they got behavior issues? Like, you know what I mean? So that's what made me want to go into social work, because I didn't want to be walking them to the bus and helping them get their coats on. I wanted to work with them one-on-one to figure out what's going on at home. So wherever you are, let that be the setup for your purpose. That's literally how I found my purpose. I was just trying to make money to get through college by working at a daycare. I didn't realize that that was setting me up to work with children and families the rest of my life. So I can't think of any entry level, because you have to have a degree to get into the field, which is crazy, but at least start with the area, the people that you think you want to work with. If you want to do administrative work, then do administrative work and get your social work degree and do macro level social work. I always wanted to do one-on-one, so I was always on the micro level. But you know, you can do social justice. There are so many different avenues when it comes to social work. So you don't always have to be a therapist. You don't always have to do one-on-one work. You can do advocacy. And so you can work at the shelter. You can work at the hospital. Like the possibilities are endless. If you're a social worker, you will always have a job. There's always a problem that society needs to fix. And that's what we're here for. So wherever you're passionate about and you feel like that's not right, something's wrong with that, get in there. That's where you're supposed to be. That's why you feel that way about that issue, because that's where we need you. You're filling in the gap. So yeah.
Great, thank you. Allie.
Yeah, kind of similar to what Brandy said, like once you have your nursing degree, you can do anything, but getting involved in the different areas that you may be interested in. So specifically to where I work in the mental health field right now, we have care coordinators and care navigators that are unlicensed professionals. A lot of them are currently in school, but they work with our patient population. They work with our providers and our therapists. So it does expose them a lot to what could happen for them in the future if they are wanting to go, whether it's the mental health side, whether it's the nurse practitioner route, and they want to become a mental health nurse practitioner. A lot of them have that exposure now through these entry-level roles. But then there's also opportunities within hospitals as well, whether it's a nursing aide, a PSA or PCA, depending on which hospital system you are at, especially in Columbus. I know the different hospital systems have different names and they all vary, but all of them will help lead and guide you towards those other careers once you are completed your degree and once you are licensed. So a lot of those different roles, and just especially the administrative roles, even in departments that you might be interested in, whether it is oncology and being a PSA or PCA on an oncology unit at the hospital. There's just different ways to get into those fields and understanding where your interests may lie, and you might find out something new about yourself. You may have thought you were interested in pediatrics and end up in geriatrics. So it all just depends, and just really exposing yourself to all of those different things.
Absolutely. So be intentional about how you're getting experience, even if it doesn't feel like, it's helping you at all. You are learning and you're gaining skills and you're figuring out what you do and do not want to do in the long term. So thank you for sharing that. So I know that we are coming up on just having a few minutes left here. So we are actually gonna skip to another question, panelists. Prepare yourselves. I'm not going in order here. Okay, so the one I do want to get out though is that there will be times when many of us fall into an other category or a minoritized group, and that could be because of our race, our socioeconomic status, or the way we wear our hair. So what advice do you have for showing up as your authentic self in the workplace? We'd love to hear that from each of you since you're all in different spaces. We'll go to Ivory first, and then I'll just kind of call on you as we go.
Yeah, so I've had the ability to work in a variety of spaces where I felt like I could fully show up as my authentic self, in spaces where I didn't feel that way, and where that made my work feel a lot harder and felt a little draining, right? And tough some days to do the things that I really enjoy. And so for me, I think it is a couple of things come to mind. Finding someone, whether that is someone within your immediate workspace or someone who is maybe in a similar field that can serve as a mentor or an advocate for you, that you can process things with, right? Because I know sometimes when you're in those spaces and you feel like maybe someone has said something that is a microaggression or has said something that has made you feel uncomfortable or othered, sometimes we can question ourselves of like, maybe I'm just, over analyzing this, or maybe they didn't really mean it this way, right? So I think it can be really helpful to have an advocate or a safe person that we can talk to. Once again, someone that is either in your space or someone that is just a trusted source that you can process with. And then I think it is, stepping into some bravery. Obviously, there comes some pros and challenges with that, of the biggest challenge of potentially losing your job. But I think taking the space to advocate and say, hey, this happened to me and this wasn't okay. I think taking the moment to address that, because sometimes people genuinely don't know. And then when you offer that feedback, they can do something about it. So that is the other piece of advice that I would give. And then the last piece of advice is, if you found that support, whether that's through an advocate, an ERG group, you've spoken up about an issue that you've experienced and you're still, not feeling like you can show up as your authentic self, or that your work or your identities are not being respected, I think that means it's a time to look for another space to work in, a space where you can show up, because the work that we do, 40 hours, sometimes 40 plus hours a week, right, is already a lot and can already be stressful. So I think it's very important for your health and wellness, right? So many people so many of my friends, you know, talk about the stresses they have and meeting with their therapist because of their work life challenges, right? And so, in my opinion, it's not worth it. Obviously, that can be easier said than done if it's harder to find somewhere else to work. But I think that is the space and the time where you start looking for other opportunities.
Absolutely. Thank you. Vivian, you'll speak to that question.
Yeah, I very much agree with almost everything she said there. One thing I would just say is when you go to a job interview or any kind of exposure at an office where you're just kind of trying to figure out this is a good place for you, you know, look at that place and, you know, you're interviewing them too. I think, you know, there's kind of this idea, especially when you're starting off, like you just need a job, you're going to do, you know, I want them to like me. I want to do everything to be, you know, their perfect candidate. But again, like you said, you're going to be at this place for 40 plus hours a week. It needs to feel like a place that isn't going to drain you, you know, and make you less productive and make you not enjoy, you know, the field that you've worked so hard to get your degree in or your experience in. So that is definitely one thing I would say, you know, kind of look at everything, try to talk to the people that work there. You know, it's kind of hard, you know, when you're interviewing somewhere, especially when you're kind of just starting out, but you know, those are important thoughts, I think. You know, you're just not there to be the perfect candidate. This is a place for you also to, you know, grow and develop your career. The other thing, you know, I would definitely say is one thing that has helped me kind of work through a lot of things as we grow in our careers is staying in contact with the people that I went to school with in the NP track, Women's Health Nurse Practitioner track. We still talk about things. We all kind of know the similar providers in town because we're all in kind of the same, you know, kind of spaces. So those people are very helpful to kind of go through and talk with things as you get out into the real world, because you know them well, you've been through your schooling with them, you've probably shared a lot of good experiences, but a very good sounding board to keep. They've definitely been a good context for me.
Absolutely.
Yeah.
In the interest, I know we just have a few minutes left, but I did see a question come through the chat. So we're going to go ahead and answer that before we wrap up here. So it looks like we have a student who's currently in the RN program at Columbus State. Says, for Vivian, is there a clinical or patient experience that you can share that helped make you a better nurse practitioner in women's health? And then
Sure.
for Ivory, Allie, and Brandy, in your experiences collaborating with other healthcare workers or nurses, what do you think they could and should incorporate more of into their practice? And some additional nuggets there. So I'll let you read her nice comment, or their nice comments. So if you'll go ahead and speak to that, Vivian, and then we'll jump in.
So one thing when you were talking about kind of entry level, I know it wasn't on that question. I really think that working as a PSA on a floor in a hospital is one of the best experience I had about this is what kind of acute care is like. You're going to see the running around, the busyness, the monitors beeping. It was probably one of the best things I did to prepare myself for what being a nurse would be like. So I would encourage that if you want to be a nurse, just go be a PSA in an area that you think you would find interesting. You will find it valuable. It's very hard when you become a nurse to kind of walk into a patient room and kind of control the floor. That will help you so much. That was one of the best things. In terms of other experiences, I would say I really sought out different experiences when I was in nursing school. So women's health nurse practitioner track. So we did a lot of obstetrics and GYN. I knew I really wanted to consider oncology as a track. So I sought out some contacts to be at Stephanie Spielman for a few days and kind of see what that was like, and other OSU offices. And I think, you know, just kind of exploring those different ways you can be in those areas and not just kind of what is given to you in education is super important. Because when I went to those days, I was like, yes, this is really how I want to focus my career. And it was so helpful. So, you know, I always encourage people, if you have any interest in oncology, I have students come shadow me all the time. I take students when I can, in terms of my, you know, what kind of time I have, but it's always a good idea to go and see what it's really like before you commit to, you know, a track or an education plan, because, you know, things are different when you get out there. So.
Absolutely.
Yeah.
Ivory, Allie, or Brandy, do any of you want to speak to the second part of that question there? Let's see. So what do you think? Working in your experience working with healthcare workers or nurses, what do you think they could and should incorporate more of into their practice?
Yeah, I can speak quickly on this one. I work with a lot of like referrals with different health organizations, different hospital systems, all of those things. And I think having team members or teams that are dedicated to that handoff process, so whether it's care coordination teams, referral teams, would just help kind of break the barriers for patient entry and patient access so much more. Just because there is like a liaison for them, they'll have like a built-in advocate on both sides. It's really, really hard at times to get patients great care when we have this care coordination team that I manage and I lead, but we don't have anybody to communicate with on the other end. So I think just building out care coordination programs and having people in those dedicated spaces could just really help with that collaboration and just getting people the care that they need.
Great, thank you. I know that we are at time. This was the fastest hour of my life, but it is clear that I know that's extreme, but it's clear that this topic is of interest, and I think there's a lot of great questions out there, and students we had great panelists, and so I think students were definitely eager to hear what you had to say and hear about your experiences as they might relate to where they want to end up. So I do appreciate you all being here this afternoon. Thank you to our students and other attendees, and a special thank you to our panelists. I will reach out to you afterward and see if we're able to share some contact information or get students connected if they're interested, but we certainly appreciate your time and being here this afternoon. So thanks again, and I hope you all have a great evening. And panelists, if you will hang back for just a minute, I want to get a great picture of you all, so we can definitely share that out to everyone. Thank you all.